Hello, assalamu alaikum, namaste friends. Today we are going to talk about all the important triads of medicine, starting with Beck's triad. It comprises of muffled heart sounds, hypertension, and increased JVP, mostly seen in cardiac tamponade. Next, we have the Cushing's triad, which includes bradycardia, hypertension, and increased intracranial pressure. Then we have the Charcot's triad, which includes right upper quadrant pain, jaundice, and fever. Next, we have the Honor syndrome, which includes meiosis, ptosis, and anhidrosis, everything related to eye. This Charcot's triad is mostly seen in cholangitis. Then we have the Men syndrome, which includes the 3 Ps, starting from head to toe, that is pituitary adenoma, parathyroid hyperplasia, and pancreatic tumor. Pituitary, parathyroid, and pancreatic. Then we have the Reiter's triad or the reactive arthritis, starting with arthritis itself being one of the components of the triad. We have arthritis, urethritis, and conjunctivitis, all ending with itis. Then we have the Worker's triad, which is actually seen in pulmonary embolism. It comprises of venous stasis, endothelial damage, and hypercoagulability. Next, we have the lethal triad, which is nothing but the death triad type. We have the hypothermia, coagulopathy, and metabolic acidosis. Then the very famous Wernicke's encephalopathy, which is marked by ophthalmoplegia, confusion, and ataxia. Mainly we can say COA, that is confusion, ophthalmoplegia, and ataxia. Okay. Then next we have the non-pressure hydrocephalus, in which we have the gait disturbances. Mainly it is associated with the autonomic nervous system, so you will have in the urinary involvement. Urinary incontinence is one of the components, gait disturbance is one of the components, and dementia is one of the components. Okay, gait disturbance, urinary incontinence, and dementia. You can remember NPH by the mnemonic good. Okay, by the mnemonic good. Next we have the pheochromocytoma, which includes headache, diaphoresis, and tachycardia. Headache, diaphoresis, and tachycardia. Then we have the very famous pellagra, which is seen in niacin deficiency. It includes dermatitis, diarrhea, and dementia. What kind of necklace can be seen? What are the signs in pellagra? Please do tell me. Coming to O'Donoghue's unhappy triad, which is seen in knee injury, which includes ACL tear, MCL tear, and meniscal tear. Okay, anterior cruciate ligament and medial cruciate ligament. Next, coming to abdominal aortic aneurysm, which includes hypertension, pulsatile abdominal mass, and flank pain. Okay, hypertension, pulsatile abdominal mass, and flank pain. Next is Meniere's triad, which we see in ear pathology, ENT, hearing loss, tinnitus, and vertigo. Next we have is the opioid poisoning, which includes pinpoint pupils, respiratory distress, and unconsciousness. Okay, lastly, now we can come across aspirin exacerbated respiratory distress. We have asthma and the involvement of nose, which includes nasal polyps and chronic rhinosinusitis. This was about the ENT pathologies, ENT triads. Next we have the Wilms tumor, which includes hematuria, fever, and renal mass. Next we have the Plummer-Wilson syndrome, which is seen in esophageal webs, that is esophageal dysphagia, glossitis, and iron deficiency anemia. You can remember by the mnemonic EGI. Okay, you can remember by the mnemonic EGI. Okay. Then we have the Miller-Fisher syndrome, which includes ataxia, areflexia, and acute external ophthalmoplegia. Similarly, kind of similar to Wernicke's encephalopathy, but here we don't have confusion. Instead of confusion, we have areflexia. Then we have Murphy's triad, which is seen in acute appendicitis. We have right iliac fossa pain, fever, and vomiting. Murphy's sign is different than Murphy's triad. Now tell me, where do we see Murphy's sign? It's very important sign, so you guys should know. Do comment and tell me where you see it. Then we have the Osler's triad, which includes telangiectasia, capillary fragility, and hemorrhagic diathesis. Coming to Trottler's triad, in Trottler's triad we can see conductive deafness, facial palsy, and immobility of the soft palate. It includes the sense organs basically: facial palsy, chehra, conductive deafness, the ear, and the soft palate. Okay, then we have the important Saints triad, GDH, which we can remember as gallstones, diverticulitis, and hiatus hernia. Gallstones, diverticulitis, and hiatus hernia. Then we have the Hutchinson triad, which includes Hutchinson's disease, interstitial keratitis, and sensorineural nerve deafness. Lastly, we have Grey-Rinogos triad, which includes sixth nerve palsy, ear discharge, and retroorbital pain. Okay, so these were all of the important triads which we see. And do answer the questions which I've asked, Murphy's sign related, and these signs and these triads are very simple. It's just that you have to keep on revising them. So for that, you can just have a look at my video, and it will be a very good revision for you for your final exams or university exams, or even your competitive exams. So all the very best, and if you like my channel, then please subscribe and like my videos so that it gives you motivation to make more and more videos. Thank you. Bye bye. Allah Hafiz.